Good afternoon, students. Here we are with the dissected part of the sagittal section of head and neck, which is always asked in exam, a very important feature. And with me are myself, Dr. Ankit, Dr. Kaushal and Dr. Dhaval, as usual. And this section has been prepared by Dr. Ankit himself with his own hands. Let us first show you the various structures which are involved. Forget this. First you forget this, because this is our brain. This brain will be in the next session. So except this brain, we come down just immediately below the brain. A wonderful here, beautiful section Dr. Ankit has taken, and here it is the sphenoidal air sinus. Very beautiful representation, sphenoidal air sinus. Just in front of sphenoidal air sinus, see here how beautiful these shelf-like projections are there. 1, 2 and 3. All these 3 shelf-like projections, they are called concha. So individual it is called concha and plural it is called conche. Superior concha, middle concha, inferior concha. They are shelf-like projections in lateral wall of the nasal cavity, as it was described by Dr. Kaushal and the blood supply etc. by Dr. Ankit. Now the space here below the superior concha, where I am putting the forceps, will be the superior meatus. Space below the middle concha will be middle meatus, and the space below inferior concha is called inferior meatus. Similarly, anteriorly here, this is vibrissae, the hair follicles, atria, atrium. Then we come down posteriorly, just behind the inferior nasal concha, around 1.25 centimeter behind. If I pass the forceps inside, if I show you this, where the forceps is going inside. The forceps where it is going inside will be known as tubal opening of auditory tube. This is the tubal opening of auditory tube. And this portion here is tubal elevation. Similarly, just from below and posteriorly, a fold is going down. I am tracing with the help of forceps. This fold, which is going down from the tubal elevation, will be known as the salpingopharyngeal fold. Another fold which is present here, which is going towards the side of the soft palate, is known as salpingopalatine fold. Where is the soft palate? This entire structure is the soft palate. This is the hard palate. This structure is the hard palate. Soft palate, like a curtain, it is hanging down, and here this is uvula, median projecting fold, uvula. Just below the hard and soft palate, huge bulk of tongue, and we have this genioglossus muscle. You can see the fibers of genioglossus, exact book-shaped feature. Then we have the nasopharynx. This area is nasopharynx, where the tubal elevation is there, where the auditory tube will open. Other name of auditory tube is eustachian tube. Other name of eustachian tube is pharyngotympanic tube. Behind that, where I put my forceps here, this is an empty space. And this empty space is a blind space which is called pharyngeal recess or lateral recess, or it is called fossa of Rosenmuller. It is a blind space behind the tubal opening of auditory tube and in front of this prevertebral fascia. That is the posterior wall of the nasopharynx. Then we come down over here. This is the bulk of tongue, so this area will be oropharynx, deep inside. And exactly the level of soft palate here, approximately posteriorly at this level, there will be passavans ridge. We have discussed with you during the lecture series of the pharynx. What is passavans ridge? That is a circular partition of the palatopharyngeus muscle, a circular fibers which will act as a sphincter, where this soft palate, uvula, if it is elevated, it will come in approximation with this ridge and it will close the nasopharyngeal isthmus. Below the oropharynx here, this portion will be the, from here, this will be the starting of laryngopharynx, because it lies just behind the larynx. This is epiglottis, this is vallicula, Exactly. See how beautiful this section has been taken by Dr. Ankit. This is the median glossoepiglottic fold, and this is the lateral glossoepiglottic fold, which I am holding. And give special thanks to Dr. Dhaval. Right now, he is in stooped portion, he is in stooped posture, and he is showing you all these folds. Median and lateral glossoepiglottic fold, and this is vallicula. And this is exact sagittal section, median section of the epiglottis. So this is the base of the tongue. And here, this is the starting point of inlet of the larynx. Starting of inlet of larynx. And where the forceps is going, this is the larynx. Later on, when the larynx lectures will commence, we will show you the entire structure of larynx. And here, this is the laryngopharynx, which will pass through esophagus. So, laryngopharynx will continue with esophagus, roughly at cricoid cartilage, level of cricoid cartilage. Here, this is the vertebral column, cervical column, and base of sphenoid, as this is the sphenoidal air sinus, basi, occiput, atlas, arch of atlas, odontoid process and axis, and the remaining cervical vertebrae. So here, this is the sagittal section, which is seen as it is, which is always asked in viva during the head and neck sagittal section, and in detail. Now, what other structures are asked in viva will be, supposing this nasal cavity is there. As of in today's lecture, we can ask you, what is the blood supply of nasal cavity, lateral wall of the nose, what is the nerve supply of this lateral wall of the nose, what is the lymphatic drainage, etc., which was discussed with you in detail. Similarly, in case of the oral cavity, we can ask you about tongue. Supposing we ask you, we keep forceps here, we ask the students, what is this substance? So the students have to answer, it is the substance of tongue. Then next question can be, what are the muscles of tongue, extrinsic and intrinsic muscles? We can ask you any muscle. We can ask you about the nerve supply of tongue. Same way here, in the exam we put the forceps here. What is this? Then students have to answer, this is soft palate. What is soft palate? And how many muscles are there? 5 muscles are there in soft palate. Describe each and every muscle. Once again, you have to describe each and every muscle. This is how the viva will go. Supposing we keep the forceps here, like this, and we ask the students, where is this forceps going inside? It is the opening, tubal opening of the auditory tube, nasopharyngeal opening of the auditory tube. What is the length of auditory tube? Which are the muscles which are attached to auditory tube? What is the blood supply of auditory tube? These are the questions which are asked in practicals and viva. So, here I will first give you orientation about, this is the cranial margin, skull, as usual the brain, this is the nose, these are the lips, oral cavity, tongue, mandible, root of the tongue. Similarly, this is the caudal margin, this is the cervical vertebral column, dorsal part of the neck. So this is an orientation. This is the same sagittal section of the previous one which I had shown it to you. Now see how excellent it has been taken. Each and every points, if you see here, the mandible, the tongue, the epiglottis, here you see the cervical vertebral column, you see the epiglottis, etc. It has been perfectly taken exactly in the mid plane. Once again, you should thank Dr. Ankit and Dr. Dhaval and Dr. Kaushal. They are behind all this hard work. So therefore, here, now see the speciality of these two sections. In one side, one section, entire nasal septum is there. And in the previous one, which I had showed it to you, which we had discussed with you in the previous segment, that was the sagittal section without nasal septum. So only in one section the nasal septum has been there. And the nasal septum, as has been discussed, that it is made up of cartilage and bones, various cartilages and various bones. The bone which is coming from above will be known as perpendicular plate of ethmoid bone, and the bone which will be present just posterior inferior will be known as vomer bone. It will be known as vomer bone, and the remaining cartilages. So this is the entire nasal septum which is present intact in one of the specimen. Maybe we can keep this in exam vivas. For you students, nasal septum can be asked in such a way that what is this structure, This is nasal septum. What is it made up of? Cartilages and bones. What are the bones? Perpendicular plate of ethmoid and vomer bone. What is the nerve supply of the nasal septum? What is the blood supply of nasal septum? What can be the lymphatic drainage of nasal septum? What is epistaxis? Nasal bleeding. Bleeding through nose is called epistaxis. Then what is the area where Kieselbeck's plexus is located, or that is also known as Little's area? It is approximately over here, as Dr. Ankit had taken in his lecture. And where is Woodruff's plexus located? These are certain viva questions of applied anatomy. So therefore, this is the same sagittal section. Once again, we'll go through very fast: sphenoidal air sinus. Then here we are having the nasopharynx. In the nasopharynx, I don't think so, but let me see. Auditory tube. Deep. It is very deep inside because we have to remove the nasal septum. Then only deep inside we will be able to view the auditory tube. This is soft palate uvula. Here this is the tongue. Then this is the epiglottis. This is the vallicula, median and lateral glossoepiglottic fold. Then over here, remember pyriform fossa was discussed with you. So this is where I put the forceps here. This is the pyriform fossa. Lateral wall of the laryngopharynx, where my forceps is there. This entire fossa is pyriform fossa. It was known as smuggler's fossa. Ancient times they used to smuggle certain things or certain objects. They used to keep it over here, which is bounded by thyrohyoid membrane and the laryngopharynx here in the lateral wall of the laryngopharynx. So this is the thyroid membrane, and medially it is closed by the lateral margin of epiglottis and arytenoid cartilage. Aryepiglottic fold medially and laterally thyroid membrane. So this area is the pyriform fossa. So this much is about the sagittal section of the head and neck.